everyone. So it is noon, so we're gonna go ahead and get started. My name is Faith and I'm with the Metro Council. Metro Council, which is the Metropolitan Council of Community Mental Health Centers, is a collaborative membership organization representing the public mental health systems of community behavioral health centers serving the greater metropolitan Kansas City area. We provide support to our member organizations in education, information, and resources to the public on accessing quality health services. We host the Mental Health KC Conference every May, as well as provide free webinars on the second and fourth Thursday of every month. Please save the date for our 2025 Mental Health KC Conference occurring May 29th and May 30th at Johnson County Community College. The call for presentations is currently live. Please think about applying to present at the upcoming conference, and I will put the link to that in the chats. Also, as a reminder, the views and opinions presented are those of the speaker and do not necessarily represent the opinions of Metro Council. At the end of the webinar today, we will put the link and password to get the certificates of attendance for this webinar. So without further ado, I'm very excited to introduce Xavier Salas, and he will be presenting on supporting gay male Latinos' sexual identity development through queer Latinx professionals. A little bit about Xavier is that he's an upcoming social work graduate from Columbia University School of Social Work, where he is pursuing a degree with a focus on trauma-informed care and cultural competency. With experience in the mental health field, Xavier specializes in working with individuals facing severe mental health challenges, including de-escalation and mediation. Xavier is dedicated to promoting positive sexual identity development and addressing health disparities within the Latinx community. His current research explores the need for more queer Latinx mental health professionals to support gay male Latinos and highlights the importance of representation in mental health care. In his role at the Inpatient Psychiatric Hospital Center for Behavioral Medicine, he integrates trauma-informed practices to provide compassionate, culturally competent care. He is passionate about advancing the field of social work through innovative case management and advocacy. And as a full-time student at Columbia and a full-time senior clinical caseworker, Xavier combines his academic insights with hands-on experience to advocate for the effective mental health policies and support diverse communities. So all that to say, I'm going to hand this over to Xavier now.
All right, start sharing mine. Okay, can you see my presentation? Without the presenter view? Cool, okay. Well, good afternoon, everybody. Thank you all for being here today. I especially want to say thank you to Faith for those words to get us started today. But I also wanted to thank her for providing me with the opportunity to upload and present my work and presentation with you all today. As she said, my name is Xavier Salas. I am a senior clinical caseworker with the Missouri Department of Mental Health. I am also a social work student and about to be in my final semester at Columbia University in the city of New York. I'm truly honored to have the opportunity to share my work with you all on an issue that is deeply important to me professionally, but also personally impactful, which is the critical role of queer Latinx mental health professionals in supporting the sexual identity development of gay male Latinos. So this research was deeply inspired by my time in a human sexuality class, where I became to understand how human sexuality is so much more than what we often assume for it to be. It's not just about behaviors or attraction, it's about connection, identity formation or development, and how we understand ourselves in the context of our culture and our relationships. So reflecting on how this broader perspective led me to think about the unique challenges faced by this demographic in navigating their sexual identities within the cultural frameworks that often creates barriers to the road of self-acceptance. So this topic will touch on profound intersections of identity, which is where race, cultural, and sexual orientation meet. And it highlights the unique challenges faced by this demographic. And these challenges are rooted in cultural traditions such as machismo or familismo, which often create barriers to acceptance and understanding, as well as the systematic inequities that limit access to affirming mental health care. So as a mental health professional and a student of social work, I've seen firsthand how the lack of representation in the mental health field can leave many individuals like this demographic feeling unseen and unsupported. So the absence of providers who understand the nuanced experiences of gay male Latinos create a gap in care that can lead to feelings of isolation, depression, and even self-rejection. So I hope today that I shed light on increasing that representation among queer Latinx mental health professionals can do so much more than close the gap. It can create a transformative, affirming space for individuals to embrace their identities fully. So together, we'll explore how cultural competent care can significantly improve mental health outcomes and contribute to a more equitable healthcare system. So this presentation will explore how increasing the representation of queer Latinx mental health professionals can create that supportive environment for this particular demographic, which will help them embrace their identities fully. Cultural values, systematic inequities, and societal stigma often create barriers to a positive identity development for this group. So we will examine the unique challenges that gay Latinos face, such as conflict between the traditional cultural norms that I discussed earlier and their sexual identity. And these challenges, along with the limited access to affirming mental health care, often lead to negative mental health outcomes. Affirmative therapy, which validates LGBTQ plus identities, is vital to addressing these issues, particularly for this demographic. It helped bridge the cultural values with sexual identity, providing those tailored cultural interventions to navigate the intersections of race, culture, and sexual orientation. And finally, we'll discuss the importance of queer Latinx mental health professionals who bring both their lived experiences and cultural competency, helping to reduce that stigma and foster acceptance within the Latinx community. So we will address 3 different questions. So what challenges do the gay male Latinos face in their sexual identity formation or development? And how does that representation of queer Latinx mental health professionals impact their care? And finally, what are the broader implications of increasing queer Latinx mental health professionals' representation in the mental health field? So by addressing these questions, I hope that to show that increasing queer Latinx mental health professionals is not just a solution to the gaps in care, but a step towards systematic change. And so now that you know pretty much a very specific focus of my research, let me begin by painting a vivid picture of the challenges faced by many gay Latinos in navigating their sexual identities within a culturally complex landscape. So let us start by picturing this. A young Latino man named Miguel sits on the edge of his bed in a small, bustling household. His room is filled with symbols of his heritage: a vibrant mural of the Virgin de Guadalupe above his bed, a framed picture of his family during a quinceañera, and a soccer jersey draped over his chair. While these items represent his pride within his culture, they also remind him of the weight of the expectations that he carries. So Miguel struggles with a secret that feels heavier to him with each passing day, and that secret is that he is gay. His upbringing in a family that's deeply rooted in machismo values and Catholic traditions has taught him that being gay is something to hide. It is something that is incompatible with being what's called a caballero, which is a man of honor and strength. So with each family dinner is a balancing act. While he jokes with his siblings, he carefully deflects questions about having a girlfriend or even far in the future of being married. So his parents' offhanded comments about the family reputation and about traditional values cut deep for him. So the thought of having to come out to them fills him with dread, yet the silence is also equally suffocating. In school, Miguel feels like a stranger among his peers. He overhears dismissive remarks about LGBTQ plus individuals, even from friends that he would consider close to him. In his community, where familismo, which is prioritizing family above all, is paramount, so Miguel feels like he is constantly walking on a tightrope, trying to not fall into rejection or shame. Now, Miguel's story is not unique, but for many gay Latinos, The journey towards self-acceptance is fraught with tension between the cultural pride and personal identity. That pressures of machismo deeply ingrained with those religious beliefs and the fear of familial rejection create a mental emotional maze that can feel impossible to navigate without proper support. So this presentation is about addressing that maze. It's about understanding the role of culture, family, and identity in shaping mental health challenges, and how queer Latinx mental health professionals are uniquely equipped to guide individuals like Miguel and others through it all. By embracing culturally competent and affirming relative care, we can ensure that young individuals like Miguel don't have to choose between culture and their authentic selves. So now that I have set up the stage with Miguel's story and why I wanted to do this, let's dive into a broader context of sexual identity development and why this process is especially complex for gay male Latinos. So sexual identity development is a complex, lifelong process that varies greatly across cultural, social, and personal contexts. Levi describes sexual identity as a lifelong sense of oneself as a sexual being within culturally constructed categories. And this means that sexual identity is shaped not only by the individual experiences, but also by the cultural frameworks in which the individuals do exist in. So this particular demographic faces unique challenges in sexual identity formation, balancing the societal homophobia with cultural expectations rooted in those values that we talked about, and how these norms often silence discussions of non-heteronormative identities, leaving many to grapple with isolation or internalized homophobia. Additionally, socioeconomic barriers such as like poverty, limited education, language obstacles further restrict access to supportive resources. As a result, this group experiences higher rates of depression, anxiety, and other mental health disparities compared to non-Latinx LGBTQ plus populations or counterparts. There's a significant gap in care is the lack of the queer Latinx mental health professionals who, like I said, are uniquely equipped to providing such affirming, sensitive support. And these professionals bridge the divide between the cultural values and identity acceptance, creating therapeutic environments where clients feel understood, validated, and heard. So to better understand the challenges and nuances of sexual identity development, we can turn towards the theoretical models that provide insight into this journey and its intersection with culture. So to fully grasp the complexity of sexual identity development among this population, it's essential to examine theoretical frameworks that capture the nuances of identity formation and the challenges involved. And these models provide insight into the interplay between personal experiences, cultural values, and societal expectations. And one of those influential models is Cass's developmental model of the closet, which outlines a 6-stage process that many LGBTQ plus individuals navigate in forming their sexual identity. And this model highlights the psychological and social journey individuals undertake, particularly those facing stigma and rejection due to their sexual orientation. This process begins with identity confusion, where an individual first starts to question their sexual orientation. And for many of these particular demographic, the stage often involves intense feelings of isolation, fear, internal conflict, as their emerging identity clashes with the cultural norms rooted in these family values. And these values traditionally emphasize rigid gender roles and family loyalty, which then creates an environment where non-heteronormative identities are seen as incompatible with cultural expectations. And through this process, the journey progresses through stages of identity comparison and identity tolerance, where individuals may start to feel to accept their orientations internally, but will continue to struggle to reconcile it with societal and/or familial pressures. So this tension can lead to feelings of isolation, shame, particularly when their external support systems are lacking. And in contrast, identity acceptance and identity synthesis represent a more affirming stages where individuals embrace their sexual orientation and integrate it into a more broader sense of self. So for gay Latinos, reaching these final stages often require overcoming significant cultural and systematic barriers, including family rejection, religious judgment, and societal discrimination. CASA's model provides a structural understanding of identity development, but underscores the prolonged nonlinear journey faced by this demographic. So it demonstrates how cultural expectations can delay or complicate the process of self-acceptance, and highlighting the importance of supportive and affirming mental health interventions. And again, CASA's model offers that structured pathway, but queer theory presents a contrasting fluid perspective on identity formation. And the research emphasizes that queer theory rejects the rigid binary categorizations of sexuality and gender, offering a more inclusive framework that accommodates diverse and intersecting experiences. So for gay Latinos, queer theory provides a lens through which they can explore their identities beyond traditional labels, integrating that cultural, racial, and sexual identities in ways that can reflect their lived experiences. So queer theory is particularly empowering for individuals whose identities do not fit nearly into a binary or Western conceptualizations of sexuality. So for example, like queer theory acknowledges how cultural heritage and racial identity intersect within sexual orientation, but that allows gay Latinos to define their identities on their own terms. So this perspective can be liberating in contexts where traditional frameworks feel restrictive or exclusionary, offering a path towards self-expression that embraces all facets of their being. Both models that I discussed illustrate the multifaceted journey of sexual identity development. So CASA's model provides that roadmap of understanding the stages of self-acceptance, while queer theory offers the flexibility to incorporate the unique intersections of culture, race, and sexuality. Together, these frameworks highlight the need for mental health supports and address both structured and fluid aspects of identity formation. Culturally competent mental health professionals, particularly the ones that I'm trying to advocate for, are uniquely positioned to navigate these complexities. So by integrating both the structure approaches from CAS within the inclusivity of queer theory, mental health professionals can provide tailored and interventions that resonate with the lived experiences of this demographic. And the combination ensures that mental health can not only address challenges of identity development, but also empowers individuals to embrace their identities in a way that aligns with their cultural and personal values. Exploring sexual identity development in both models provide a comprehensive understanding of the challenges and triumphs faced of this demographic. And these frameworks emphasize the importance of culturally competent care in supporting this formation, affirming the need for these particular mental health professionals that can bridge the cultural expectation with personal authenticity. And by recognizing the structured progression of identity and the fluidity of personal experience, we can create therapeutic spaces that validate, empower, and uplift this underserved population. So these models highlight the stages of identity development, but when we consider the social and cultural factors unique to gay Latinos, the process becomes even more intricate. So this is where we'll talk about the unique challenges faced by this demographic. But to understand the mental health needs, we need to grasp the concept of intersectionality, which is a framework that was coined by Kimberly Crenshaw in the late 80s, where it's described as how various social identities, such as like race, cultural, gender, sexual orientation, socioeconomic status, overlap to create unique experiences of both privilege and oppression. So for gay Latinos, these intersecting identities result in a complex, often challenging journey of identity formation and self-acceptance. And within many Latinx communities, those traditional gender norms play a dominant role in shaping expectations. So concepts, like I said, machismo, which is like an ideal of assertive and dominant masculinity, and caballerismo, which is emphasizes honor and responsibility, set rigid standards for male behavior. These cultural constructs leave little room for non-heteronormative identities, creating an environment where gay men feel pressure to conform outwardly even if it means suppressing their true selves. And for some, adherence to these norms can manifest as identifying as heterosexual, which can be seen as a survival mechanism to navigate the expectations of family and their community. This discord between external conformity and internal truth often results in psychological distress, such as depression, anxiety, and internalized homophobia. At the intersection of ethnicity, race, and sexual identity, gay Latinos experience discrimination on multiple fronts. So within their community, homophobia is fueled by those cultural and religious values that creates barriers towards acceptance. So, for example, Catholic teachings often conflict with the acceptance of LGBTQ plus identities, leaving many of these individuals to navigate feelings of rejection from both their families and their faith communities. While simultaneously, in predominantly white LGBTQ plus spaces, racism and cultural exclusion present additional challenges. So these spaces are often centered on white queer narratives and fail to address the unique cultural and racial experiences of LGBTQ plus people of color. As a result, gay Latinos may feel marginalized even within communities that are supposed to be designed to provide support and affirmation. So there's a dual burden of homophobia and racism that can exacerbate feelings of isolation and exclusion that can continue to contribute to poor mental health outcomes. Families play a pivotal role in the lives of many Latino individuals, where the familismo, which emphasizes the loyalty, unity, and prioritization of family needs above individual desires. While this cultural value fosters strong family connections, it also can create tension for those demographics whose identities may be viewed as conflicting with those traditional family roles and expectations. And within many families, the emphasis on maintaining respectability and cultural traditions means that coming out as gay may be seen as incompatible. So, for example, the expectation to marry or to have children often clashes with LGBTQ plus identities, leaving many gay Latino men to suppress their identities to avoid that disappointment. And this internal conflict can lead to feelings of guilt, shame, and rejection. Religious institutions, particularly with the Catholic Church, play a significant role in shaping attitudes towards LGBTQ plus individuals. So while faith provides a sense of community and belonging for many, it also can be a source of exclusion for those identities that are not affirmed with religious texts. And many gay and Latinos struggle to reconcile their faith with their sexual identity, which create a spiritual conflict that compounds their psychological challenges. So the overlapping pressures of homophobia, racism, cultural expectations, and religious teachings highlight the urgent need for culturally competent mental health interventions. This demographic requires support systems that validates their experiences, acknowledges the complexities of their identities, and provide that safe space where they're allowed to explore and allowed to heal. Addressing these challenges through culturally relative frameworks, such as affirmative therapy, is essential to promoting resilience and fostering positive mental health outcomes. Now that we have explored the cultural and societal pressures shaping identity formation, let's examine how these challenges impact mental health outcomes for this demographic. The mental health implications for gay male Latinos are profound, multifaceted, and deeply rooted in the intersection of cultural, societal, and systematic factors. Discrimination stemming from racism, cultural norms, and family rejection creates a hostile environment that exacerbates psychological vulnerabilities. So research has consistently shown that this demographic has experienced disproportionately high rates of depression, anxiety, and substance use compared to their white LGBTQ plus counterparts. And this disparity is not only inherent to their identities, but it arises from chronic exposure to external stressors. And internalized homophobia, which is where individuals absorb societal pressure or societal prejudice, against LGBTQ plus identities, significantly affects this population. So feelings of shame or guilt about one's sexual identity often contribute to heightened levels of depression, anxiety, and even low self-esteem. Internalized homophobia is amplified in environments where machismo ideals dominate that reinforce that stigma around non-heteronormative identities. So this stigma may compel individuals to hide or suppress their sexual orientation, which would then further isolate them from support networks and resources. And mental health stigma within many Latinx communities adds another layer of complexity. So therapy is often viewed as a necessary or a sign of personal weakness, with mental health challenges that are being belittled or dismissed. And there's like cultural sayings such as like los hombres no lloren, which is like no men don't cry, perpetuate harmful notions of emotional suppression, particularly for men. As a result, many gay male Latinos delay or avoid seeking therapy altogether, compounding their mental health struggles. The pressure to conform to traditional masculine ideals can lead to detrimental coping strategies. To maintain personal appearances of adherence to machismo, some may engage in behaviors such as like substance use, excessive drinking, or risky sexual practices. And these behaviors often act as mechanisms to manage their stress or conceal their identity, but ultimately worsen their mental health outcomes. There's also racialized stereotypes such as hypersexualization, further complicate this dynamic, contributing to body issues and even leading to eating disorders. Intersectionality further intensifies the burden faced by this demographic. So their dual status as both ethnic and sexual minorities expose them to compounded discrimination from both their cultural communities and the broader society. So for instance, like rejection from family members rooted in these belief systems can leave individuals without critical emotional support, while racism within LGBTQ plus spaces can create feelings of exclusion, and these overlapping stressors can often result in psychiatric distress and reinforce the need for these culturally sensitive interventions. These significant challenges underscore the necessity of tailored, culturally competent healthcare. So gay male Latinos need therapeutic spaces where their intersecting identities are understood and validated. And affirmative therapy has been proven effective in addressing these needs. This approach incorporates cultural nuances and recognizes the unique experiences of gay male Latinos, offering a path towards healing, acceptance, and resilience. Through affirmative therapy, and also with the presence of culturally competent providers, we can begin to dismantle the systematic barriers that perpetuate these mental health disparities and create pathways for individuals to thrive. So given these significant mental health challenges, the need for culturally competent care becomes evident. And this is where affirmative therapy plays a critical role. So affirmative therapy is described as an essential approach to addressing mental health needs of gay male Latinos. It's a form of psychotherapy and specifically designed to affirm and advocate for individuals marginalized by their sexual and gender identities. So it focuses on validation, empowerment, and cultural sensitivity, where it will ultimately foster healing environments where clients can explore their identities without fear of judgment or rejection. And a key strength to affirmative therapy lies in its ability to enhance the therapeutic alliance between clients and their mental health providers. And that trust, or that relationship built on trust, empathy, and a shared understanding of the client's experiences. So for many gay male Latinos whose struggles often intersect within cultural and systematic barriers, that mental health providers' role extends beyond just listening. It involves actively acknowledging and addressing issues like the family rejection or societal stigma. One example of affirmative therapy is called the ESTEAM intervention, which is an acronym for Effective Skills to Empower Effective Men, which focuses on minority stress through cognitive behavioral therapy. And it shows that this intervention effectively reduces anxiety, substance use, and depressive symptoms in Latino, gay, and bisexual men. And they do that by incorporating their lived experiences into the therapeutic process. So this process underscores the importance of tailoring mental health professionals to the unique needs of this population. Culturally adapted therapeutic models further enhance the effectiveness of affirmative therapy by integrating those Latinx cultural values, such as like respeto, which is like respect in English, into treatment. So research was shown by Duarte that demonstrated how culturally adapted CBT that helped gay Latino adolescents improve their mental health outcomes by addressing both individual and family dynamics. And this adaptation allowed mental health providers to navigate complex issues such as merging traditional family expectations with sexual identity while promoting open communication and healthier relationships. This therapy also provides tools to address internalized homophobia, which is prevalent among this population due to those societal pressures or cultural expectations. So through techniques such as like cognitive restructuring or other things, clients can challenge negative self-perceptions and replace them with affirming, self-empowering beliefs. By doing so, mental health professionals can help clients foster self-acceptance and resilience. And the role with affirmative therapy in identity development is particularly profound because with this population having to navigate both the cultural and sexual identities, it can be fraught with tension. So this therapy provides a safe space to explore these complexities, empowering those to integrate their sexual identity into a broader self-concept. And research shows that such integration leads to better mental health outcomes, increased self-esteem, and a greater sense of belonging. And mental health professionals who employ these particular techniques also address the systematic challenges faced by this population, such as discrimination or lack of representation. This dual focus on personal empowerment and systematic advocacy is vital for fostering both individual well-being and broader social change. Despite its promise, the accessibility of affirmative therapy remains a challenge. Systematic barriers such as like lack of the culturally competent providers or even limited bilingual sources prevent many gay male Latinos from accessing this type of care. Financial constraints, there's even like geographical limitations or even institutional biases that further compound these issues, leaving vulnerable populations underserved. So by addressing these systematic barriers, by expanding affirmative care training, and by increasing the representation of queer Latinx mental health professionals in this field, we can ensure that more individuals benefit from this transformative approach. So let's talk about these systematic limitations a little bit more in depth. Despite the transformative potential of affirmative therapy, gay male Latinos often face significant barriers when trying to access mental health services. And these challenges arise from a combination of cultural, linguistic, and socioeconomic and systematic factors that collectively hinder their ability to receive appropriate care. One of those major barriers is the lack of cultural competency among these mental health providers. Those providers who are unfamiliar with the unique experiences of gay male Latinos or any other LGBTQ plus identities may struggle to understand how cultural factors intersect with sexual identity. And that lack of understanding can result in misdiagnosing or overdiagnosing or inadequate treatment plans that fail to address the root causes of distress. For instance, internalized homophobia or even like family rejection can may be overlooked in favor of a more generalized approach, leaving those clients feeling misunderstood or invalidated. And also like mental health assessments often lack cultural sensitivity that leads to diagnostic errors. Standardized assessment tools frequently fail to account the nuances of cultural expression, such as the stigma around mental health around LGBTQ plus or even Latinx communities, or the ways that depression might manifest differently across cultures. Language barriers also further complicate access to care. We all know there is a shortage of Spanish-speaking and bilingual mental health professionals in the US, so that limits access for individuals who feel more comfortable communicating in their native language. So that absence of representation can exacerbate feelings of mistrust towards a mental health care system, particularly those who have faced linguistic discrimination or systematic biases in other areas of their lives. For many gay male Latinos, seeking therapy from a professional who shares their cultural background and language can be a source of comfort and trust. But without these options, clients may avoid seeking care altogether, and which further isolates themselves from potential support systems. We also can talk about socioeconomic factors, how that plays a critical role in shaping mental health outcomes. Many individuals in this demographic face economic hardships like low-paying jobs, lack of health insurance, and in some cases, undocumented statuses. And these challenges create additional stressors that exacerbate mental health issues while simultaneously limiting access to affordable care. Living in underserved areas or even like rural communities or impoverished urban areas compounds these difficulties. So regions like the ones I just stated often lack culturally competent mental health providers, leaving this demographic with few, probably if any, viable options for care. Plus, the high cost of private therapy and the lack of sliding scale services further reduce the accessibility for those limited financial resources. Institutional mistrust is another obstacle. Many gay male Latinos carry deep-seated mistrust of the mental health system due to past experiences of discrimination or stigmatization. And this mistrust is reinforced by a history of systematic inequities such as racial profiling, a lack of cultural representation, biases within the healthcare system. And these experiences can create a psychological barrier to seeking care, as individuals maybe fear to be judged or misunderstood, invalidated, or even being mistreated. Furthermore, mental health services often inaccessible due to rigid institutional structures, such as like limited office hours, lengthy intake processes, a lack of outreach efforts tailored to this particular demographic discourages those from engaging in it with available services. So without proactive measures to address these systematic barriers, this gap will just continue to persist. Addressing these barriers also requires a multifaceted approach. So increasing the recruitment and training of queer Latinx mental health professionals can help bridge those cultural and linguistic gaps in care. So that's by offering bilingual services, incorporating culturally competent assessment tools, expanding affordable therapy options are essential to creating a more inclusive system. Additionally, outreach efforts designed to reduce the stigma and build trust within Latinx communities can also encourage individuals to seek the help that they need. So by fostering a mental health care system that is both culturally competent and accessible, we can empower these individuals to overcome these barriers and receive the affirming care. And such efforts are not just necessary, but also transformative, as they can help mitigate the profound mental health disparities faced by this population. So in ways to address these systematic gaps, we need more professionals who can bridge those gaps between the cultural and linguistic divides. This is why I'm here to talk about why queer Latinx mental health professionals are uniquely equipped to fulfilling this role. So now that we understood the unique challenges and limitations faced by this demographic, let's discuss how we as mental health professionals don't even have to be identified as queer or Latinx, just as a mental health professional can help better serve this population. And one of the most important steps we could take is providing culturally competent care. Cultural competency refers to the ability of healthcare providers to understand and respond to their patients' cultural and linguistic needs. And that requires not only an awareness of the patient's background, but also the ability to integrate that knowledge into the treatment. And so queer Latinx mental health professionals play a vital role in addressing the unique needs of this population. So their shared cultural and sexual identities foster trust and understanding that creates a stronger therapeutic alliance. And for this population, this means understanding how their cultural values, such as family loyalty or the expectation to be machista, can influence their mental health and willingness to engage in therapy. It also means creating a space where they can explore their identity without judgment. And this connection is so crucial for establishing that safe and supportive environment where they feel validated to openly express their experiences. And these professionals are also equipped to provide that culturally relevant care, which using inclusive language and normalizing discussions about sexual orientation, sexual health, and trauma altogether. And they can create safe spaces for clients to explore their identities without that judgment. And research indicates that when Latino gay men perceive their mental health professional as culturally competent or aware, they report higher satisfaction with their care and more likely to continue engaging, seeking additional help. And there's also a growing body of evidence that shows that culturally competent care improves mental health outcomes. So again, with research showing that clients who feel that their therapist understands their lived experiences and integrating their cultural context are more likely to stay engaged and have better mental health outcomes. So incorporating cultural traditions into therapy can also help clients build resilience. So for many gay male Latinos might find it helpful to discuss how their cultural values have shaped their experiences in coming out. And by validating these experiences, these mental health professionals can empower these clients to reconcile their sexual identity with their cultural identity. And they also can serve as a role model, demonstrating how to navigate the complexities of cultural and sexual identities. And their presence within the mental health field does not only provide support, but also challenges those stereotypes and promotes inclusive practices. By increasing that representation, we unlock a range of benefits that not only improves individual outcomes, but also transforms the mental health field as a whole. And so let's take a little look at some of these benefits. Expanding the presence of these professionals is more than just an issue of representation. It's a pivotal strategy for addressing critical gaps in mental health services for this population. When clients encounter mental health providers who reflect those experiences, it creates a mutual respect. And the shared background fosters a therapeutic environment where this population may feel encouraged to express their struggles openly. And the research had underscores that clients are more likely to seek help when there's a deep understanding of their unique challenges. And these mental health professionals are equipped to navigate these cultural complexes that influence the identity development. And studies shown that in integrating these cultural contexts into therapy improves the client outcomes, it reduces the disparities, and leads to a more meaningful therapeutic relationship. For many gay male Latinos, having mental health professionals who actually successfully navigated the cultural and identity-based challenges themselves often offers a source of inspiration and empowerment. And these role models not only challenge pervasive stereotypes, but also encourage self-acceptance and resilience, demonstrating to those that are seeking the help that thriving within one's identity is achievable. A diverse mental health workforce that includes queer Latinx mental health professionals bring invaluable perspectives to policymaking, training, and practice altogether. So these contributions help shape systems that are inclusive and reflective of communities that they serve. So by promoting a more holistic and culturally informed approach, the profession can better meet the needs of underserved populations like gay male Latinos. The ripple effects of increased representation goes beyond just individual care. Having that greater visibility of queer Latinx mental health professionals reduces stigma around LGBTQ plus issues within the Latinx communities and opens pathways for conversations to talk about like acceptance. And these shifts encourage families and communities to become active allies in supporting gay male Latinos, which then would foster resilience and systematic change. By cultivating a mental health workforce that includes more queer Latinx mental health professionals, we are not only improving access to care, but we're also contributing to a more transformative vision of mental health. One that's going to affirm, that's one that's going to validate, and one that's going to empower marginalized identities. So now let's explore some of these actionable strategies to increase the number of queer Latinx mental health professionals and expand culturally competent care within the field. So to effectively support this population, it's very imperative to focus on strategies that increase the number of these professionals. And these professionals bring critical lived experiences and cultural insights that bridge the gap in culturally competent care. Expanding recruitment or training programs that prioritize diversity and cultural competency is a foundational step. So universities and training institutions can create dedicated scholarships. They can have mentorship programs or even outreach initiatives aimed at encouraging queer Latinx students to enter the mental health field. Family acceptance is a cornerstone in improving mental health outcomes for this population. And research done by Harper in 2016 and other studies as well consistently has shown that LGBTQ plus individuals with supportive families are significantly less likely to experience depression, anxiety, and suicide ideation. So acceptance also strengthens family bonds and fosters environments where the individuals feel safe and validated and understood. So to promote family acceptance, community education programs are essential. So those look like workshops, support groups, most importantly, like bilingual resources that can help families understand LGBTQ plus identities and reduce that stigma. These initiatives can be impactful in faith-based settings where discussions can integrate cultural values with messages of inclusivity. Community organizations, there's some like the Parent Families and Friends of Lesbians and Gays, and also the Trevor Project offers toolkits and training to guide families in creating affirmative spaces for the LGBTQ plus members. But beyond family support, community spaces also play a pivotal role in fostering a sense of belonging and identity for gay male Latinos. So there's events such as like Pride, Latinx cultural festivals, LGBTQ plus affirming church services can provide opportunities to celebrate intersectional identities and self-welcoming environments. These spaces not only reduce isolation, but it also empowers individuals to embrace their authentic selves. And for many of these individuals, these events serve as a lifeline, offering visibility, it offers support and representation. So organizations like local LGBTQ plus centers or even Latinx focused advocacy groups are vital in hosting these events and creating networks of support. So with partnering with such organizations, these mental health providers or other, those who do not identify as Latinx or queer, can extend their reach and foster stronger community ties. On a systematic level, legislation like the Mental Health Workforce and Language Access Act, that's a very long act, represents a significant step forward. This policy aims to improve language accessibility, promote culturally competent care, which then would make mental health services more inclusive for queer Latinx individuals. And these efforts are particularly important for non-English speaking clients who often had faced significant barriers when seeking that care. Expanding these legislative initiatives can include funding for like pipeline programs that can help recruit and train a diverse mental health workforce. So examples could be like government grants could support additional educational pathways for queer Latinx students. This could be from like high school all the way to graduate programs, and this would ensure sustained representation in the field. I also think mentorship is another key strategy for building a more inclusive mental health workforce. So pairing aspiring queer Latinx professionals with mentors who share their experiences on can provide guidance, inspiration, and practical advice. And these relationships can help dismantle barriers and foster professional development in a field where Latinx and LGBTQ plus voices have historically been underrepresented. In addition, institutions can establish professional pathways that provide like job placements, internships, and continuing education opportunities tailored to queer Latinx professionals. And these pathways not only diversify the workforce, but it also improve retention rates by addressing the unique challenges faced by LGBTQ plus Latinx practitioners. Addressing challenges requires a unified effort from educational institution, policymakers, community organizers, and even the mental health professionals themselves. And collaboration among these stakeholders can amplify the impact of individual initiatives, which then would create a mental health landscape that is inclusive, equitable, and affirming. And by investing in these strategies, not only benefits gay male Latinos or other LGBTQ plus identities, but also enhances the mental health field. And promoting diversity and fostering cultural competency and prioritizing community engagement, we can ensure that individuals have access to the care that they deserve and need. So considering these strategies, it's clear that the collective action is essential. So now let's reflect on the broader implications of this work and envision this path forward toward a more inclusive and mental health system. So as we wrap up, I would like to bring our discussion to a full circle, that highlights the profound impact of culturally competent care and the importance of representation in the mental health field. So this short testimonial video, it comes from a Latino that identifies as gay who has experienced lifelong changing effects of culturally competent care. Hearing firsthand how culturally aligned care supports mental health and identity acceptance illustrates why representation is so vital it's so vital and why I'm here advocating for such.
My name is Juan Acosta. My pronouns are he, him. I am a mental health advocate, and this is my mental health journey. I, like many, did not have conversations about mental health growing up, and mental health was not something that was talked about in my family or in my community. In middle school, I was really struggling. I was being bullied in school for being gay, and I was being called names before I was even able to identify myself as a member of the LGBTQ plus community. And it felt really intrusive to me. I come from a family that immigrated to this country, and seeing my parents work day and night to put food on the table, I didn't want to stress them out over some peers in school being mean to me. And the reason why I didn't talk about my mental health was because I grew up watching a lot of Spanish media. And I oftentimes heard that, men have to always be tough and that tears and showing any kind of emotion is a sign of weakness. I also didn't want to share what I was going through in school because I wasn't out yet and I didn't want my parents to know that I was being bullied because I was gay. And I discovered that I was really struggling. And when I asked a school counselor, they pointed out different things around mental health and they started to give me definitions and explaining what mental health was. And my life completely changed because I was able to now understand what was happening to me. And a lot of my life began to make sense. And I tried to then learn how to cope with my own mental health struggles and try to educate those around me. But I was also trying to open up conversations with my family about this. I learned about their own struggles. And to this day, I have a relationship with my parents that we are open about what we've gone through. They've told me about their childhood, and I'm now able to share a lot of things that I never thought I would share with them.
This is why queer Latinx mental health professionals are essential for addressing the unique cultural and identity-based challenges faced by gay male Latinos. These professionals bridge the cultural divides. They offer empathetic, affirming care that is often lacking in traditional mental health services. But despite progress, significant gaps remain in understanding the mental health needs of this population. Existing research frequently generalizes LGBTQ plus or Latino experiences, and they fail to capture the intersection of identities which are shaped by factors like immigration status or socioeconomic challenges or even geographic barriers. For instance, undocumented individuals face heightened stress due to deportation fears, while limited resources in rural areas exacerbate mental health disparities. Culturally adapted therapy, such as the affirmative therapy, has shown promise in addressing these gaps by incorporating those Latinx cultural values with the LGBTQ plus affirming practices. However, increasing the representation of queer Latinx mental health professionals is crucial to fully meet the needs of this population. Collaborative efforts from educational institutions, policymakers, community organizers, and mental health professionals themselves are key to recruiting and retaining these professionals, fostering an inclusive and effective mental health system. I just want to say thank you all for your attention and being here. I know it was a long one. I hope this presentation has highlighted the importance of culturally competent care and the role that queer Latinx mental health professionals play in supporting the identity development of gay male Latinos. And by prioritizing their support, we can work toward a more inclusive and mental health system. And in the end, Mereces Todo lo Bonito, which basically saying you deserve everything beautiful. So thank you for listening.
Thank you so much, Xavier. I know how important this presentation is, and I know not just for you, but for the community at large. So thank you so much. I am now, if there's any questions, feel free to put them in the chat. So far, I don't see any, but if anybody has any questions or if they think of anything later, I can put Xavier's contact information in the chat if that works, Xavier.
Yeah.
And I'm also going to put in the certificate of attendance link for everybody who would like that. And again, want to just thank everybody, echo what Xavier was saying. Thank you so much for being here. We really appreciate all of you, and we appreciate Xavier's hard work and dedication to this. And I want to remind everybody that this webinar was recorded, and you can access the recording at the mentalhealthkc.com website. But yeah, one last call for any questions. I don't see anything popping up. All right, well, our next webinar is on the second Thursday next month from 12 to 1 p.m. and we hope to see you all there. All right, thanks everyone.
Bye, guys. Thank you.